Hi, everyone. Welcome back to the podcast. Before we get into the episode, I want to share some exciting news. We have hit 10,000 downloads. Such a huge success in such a short period of time because of all of you. Thank you so much for all the support, the shares, the feedback you've been giving us. We are truly honored to be part of your day. To say thank you, we are going to bring you even more educational content. Beginning August 2nd, we'll be releasing a new episode every Wednesday. And these episodes are going to be shorter, but very content-rich episodes designed to bring you clinical-focused information. Our regular weeks will remain as longer episodes with our amazing expert guests and industry leaders. We hope you love the new content, and we look forward to hearing your feedback. We are always looking to improve your podcast experience, so be sure to let us know what you think. Thank you again for our 10,000. We love you all. Check in with you soon. Welcome back to the Making a Multi-Million-Dollar Med Spa podcast, where we have real conversations about what it takes to run a successful business. Thank you for joining us as we share our day-to-day successes and, even more importantly, failures and mistakes. Listen in as we host some of our peers, colleagues, and other experts in the field. We hope you enjoyed today's episode. All right, so welcome back to the Making of a Multi-Million-Dollar Med Spa podcast. This is Kathy Toronto, and I'm here with Dr. Lina Vargas. I'm so excited to have you on today. You're just such an inspiration. I was kind of stalking your Instagram this morning, and there are so many fun videos. I love the one with it's probably because I have a 7-year-old, but especially I had the Mario Kart where you guys are like racing in to get.
Oh my gosh, we had so much fun.
And it just looks like your team just really enjoys it as well. So it's fun to see all of that. But
yeah,
let's start out with a little bit about your background. You know, where did you grow up? What were your parents? Do you have other children in your family?
Well, first of all, thank you so much for inviting me. I've been following you on Mint and this podcast. So for me, it's an absolute pleasure and honor to be here. So thank you for that. And then, I am from Colombia. I was born in Bogota, and I was born and raised. I did all of my schooling, did medical school back in Bogota. And then I moved to Cleveland, Ohio in 2005 to do a research fellowship in cardiac and vascular surgery, and then ended up doing vascular surgery. I stayed there for that. I finished in 2014. It's crazy that next year I can say that I've been a vascular surgeon for 10 years. Wow. It's absolutely insane. Wow. Yeah.
And you only look like you're 22. How'd you do all that?
I know, it's like hard for me to believe, but I essentially for the first years of my career, I practiced as a vascular surgeon, taking call, hospital-based, doing everything, vascular surgery, until 2018 when I saw the light. And things, I definitely believe that things happen for a reason. And at that point, so many things were kind of happening that just helped me and my husband kind of make the decision. That's something we had been thinking about, of just going on my own, opening my own private practice, just becoming my own boss, being able to control my life, being able to be there for our family. We have 2 daughters, and just have that kind of control, not depend on the hospital, not take call. And I opened this private practice. I'm the owner of Lumina Vein Aesthetics Institute, and we're in Windermere, Florida, which we absolutely love. And I decided I gave up my arterial practice. I really devote my work to vein disease and, essentially vein work, which is what I really, really love and specialize in. And then very early on, we adopted, the aesthetic side of things, mainly at first from the vascular standpoint. And then, just broadening to everything else and this amazing world of aesthetics. And that was the beginning.
Wow. I mean, such a diverse background. I have to take a step back to, moving from Bogota to Cleveland, Ohio. And, what was the culture shock of that? Or maybe what did you miss? Or what did you
Yeah, I mean, from it's definitely been crazy to go from, from Colombia to Ohio. I mean, I lived in Bogota, which is crazy, almost like think New York City, like, just a concrete jungle, very busy, crazy, just very little time, lots of traffic. So going to Cleveland was nice in that it was definitely like the pace was much slower, different kind of environment, but then definitely for sure, as far as the weather was like the biggest like change
I
because
bet.
for those of you who don't know, there's literally no seasons in Colombia. So the weather is literally the same year round. And going to Cleveland, which is like winter, is insane.
I bet your
And
wardrobe changed.
yeah, it's absolutely crazy. So definitely that was one big thing. But then, as far as I think the cultures are very similar. And I was blessed to just really like find and make friends very easily, both at work. That's literally where I spent literally all of my time was at work anyways. And but I've always been blessed to like literally just find people who become family, that they're supportive, that helps you like not missing home as much. And thankfully we do get to go back home very often, so that makes it easier. But yeah.
Well, so, what drew you to medicine?
It's hard for me to tell. I think I've wanted to be, I always wanted to be a physician. I always wanted to be a surgeon very early. Like, I guess the only thing that I ever contemplated was architecture. I love drawing. I'm very like, I'm a perfectionist. And so that's kind of like the only thing that I considered. And that was because the health system in Colombia, had a lot of issues even at that time. And, we're talking 15, 17 years ago. And so a lot of people, like including my mom, they were like, I mean, it's crazy for you to go through such hard training to then face like these situations with like the broken healthcare system. Like, is it even worth it? But I'm telling you, I wanted it. It's what I wanted the most. And so, I just went through it and I don't regret it a single day. Now, what I did know, like going through medical school, is that I wanted to come to the United States to do my my training following medical school. So, I was the crazy one with like all the medical books in English.
I know. I was
Yeah,
thinking
so like
that
all
as
the
well.
pathology and histology and anatomy, and like all of my books were in English, even though we were in Colombia. So I was kind of like just very focused on, I wanted to come here to do my residency and do research and all of that. And so I did. I definitely wanted that from like the very beginning. And then surgery wise, that was also like very easy to me. Like I just wasn't as excited when I was in the rotations where it was like internal medicine when we're just rounding on patients. And, I loved being, just having to get to the hospital super early. We barely saw the sun, but like just everything was fast paced and just moving and go, go, go. And one day is never the same as the next. You never know what happened, what's going to happen. And the cases, if they go quick, if they go slow, if you need to add, an urgent case. So I absolutely love that pace. And so that going into surgery was also like very, very easy for me to decide.
Well, I think that's amazing that you had that vision so young. I mean, I almost feel like you kind of need it to get through
Mhm.
everything that you did, especially if your mom, who I'm sure you love and trust more than anyone in
Yeah.
the world, is saying, like, are you
Are
sure?
you
Are you
sure?
sure?
I know. I know. That's
Uh,
how moms are. I mean, I remember what I told her, like, I'm quitting my job as a vascular surgeon and I'm going to open a private practice. And she was like, oh, wait, what? Like, are you sure? Like, are you crazy? Like, and I was like, absolutely, I'm sure. And then even today, to this day, she's like, see, now you work more, than, you used to work. But I'm like, of course, I mean, when you're a business owner, you work more than, ever than if you're like, just a regular 9 to 5 or employed or whatever. But it is your baby, right? It's like,
right.
it's your project, it's your dream. And so absolutely you're going to work as many hours as you need to. I mean, it's 24/7 because you want your baby, you want the business to do well. And so, so I'm like, absolutely, mom. But I'm like, I absolutely enjoy this. And I'm just so grateful to have taken that step, and where I am right now, I'm just, I wouldn't change it for anything in the world.
So coming from the hospital and stepping away, and you're also a mom, you'd mentioned, kind of making some decisions because as a mom, you wanted to have a different type of schedule. Stepping away from that and starting your own business, what have been the biggest surprises? Maybe something that's, you didn't realize you would encounter so often, or something that's been more difficult, a learning moment, or something that's just been way better than you thought.
Yeah, I think, essentially, and especially coming from medicine, I don't know from like other, careers, we get very, very little in terms of training as far as like how to even run a business or like what it takes to run a business. And so like literally everything about the, going solo and opening a private practice, everything has been, there's definitely a learning curve, and some things have been easier, some others have been a little bit more challenging. But I think at the end of the day, it's all very obviously rewarding. I think that you never really know. I mean, you kind of like have an idea of like all the things that you're going to have to do, but then it's almost like you have to dive into and like start facing all the fires that come up, like even with like little processes and things that you would never imagine. But I think that, like, it's been amazing to just, I'm very, very lucky to, have found a team like very early on. You need that team to kind of like help you, because there's no way you can do everything, right? And so like I've been blessed to have, my manager, she has been like instrumental in making this a success. So like she's like incredibly smart and absolutely loyal, and she's Lumina, like, like family for life. And so like, she's been able to deal with some of more of like the admin things. Then, from the medical side of things, same. I mean, before you just kind of like, when you're employed, you just show up, you have your schedule, you have your patients, you do your surgery, and then, you take the phone calls, you do your charting, but that's it. But, looking at things from the business standpoint, just, you have to take so many other things into consideration as far as like, even what kind of treatments you offer, what kind of devices you bring on, and look at it from different angles as far as like the cost, what's going to be effective. There's so many other things that come with that you would have never like even thought about when, prior to owning a business. I would definitely say that, it's very rewarding when you find the right people, but it's also so challenging when, someone just does. And I know you guys are so good about like the interview process. Like I've learned so much from you, because at first you're like, and especially when you're small and, when it's harder to like, like really like be able to attract the right people. And so like going through that struggle of really figuring out who's a good fit and learning. And we've learned that you have to, like follow your gut. And even though you may like someone, if they're not the right fit for your business or they don't have the right personality, like you just have to like, move on and just find the right people. So identifying who those people are has definitely like been one of the biggest challenges.
So
For sure.
where did you find your manager? Because this is a question, I mean, I get asked a lot, and our manager and assistant manager for aesthetic care both came from Dillard's. And
Okay.
so, I think people look at like, we've got to hire someone that has industry experience. And really, when you look at what their main role is in the business, it's managing people. It's a retail type of business, and they have been hugely successful, and we're so grateful for them. But I'm just curious, where did you find your superstar?
Yeah, I literally, I win like the biggest lottery in the world with her, because so she actually was the manager at the practice at my last job in the hospital. So she was the manager at that practice. She, and then my first ultrasound tech, we were part of a team, when I was still employed by the hospital. So then, we worked amazing together. We had the same personality, like we had the same values. We treated patients the same way. And so when, it's funny because when I decided that I was, leaving and, opening the practice, and, obviously that was kind of like a long process, almost like a year from the moment I handed in my resignation because I wasn't sure if they were going to enforce the non-compete, which sometimes for physicians, you cannot work in a 25 or 50-mile radius from where you worked before. So I wasn't even sure that I was going to be able to open the practice, where I opened it. But for that year, they were like, we're coming with you. We're sticking together. Like,
I love it.
I know, it's so insane. I still like it almost
that,
makes me
so much
when I tell that story. It's because it's incredible. So this my manager, she actually decided to, because also on my contract I couldn't hire anyone from the office.
Wow.
And so she actually left the office to work somewhere else while I got everything set up. And then I was able to hire her from that.
Wow.
That just speaks volumes as far as like how, that commitment and that loyalty, and just, it is, I'm telling you, I'm absolutely blessed. It's insane. It's I just got lucky.
Like, that gives me goosebumps.
Yeah.
That's a lot of faith.
Hey listeners, it's Karen, the marketing director of Aesthetic Care Med Spa here, and I wanted to share an incredible resource that has changed the marketing game for our virtual events here at Aesthetic Care. Our events partner will provide all of the items that you need to put on a professional, organized virtual event with ease. You provide the assets, pictures of your staff, or whatever treatment that you're trying to promote. Only takes 90 minutes or so, and they do everything else. Following the event, they'll even provide you with detailed data analytics so you can see exactly how many people attended, who stayed for the entire event, track who's interested in getting your treatment or special that you're promoting. You will even have automated follow-up texts. I'm telling you, it will make your virtual events easy, breezy, and they do all of the marketing. It's incredible. For more information or to see a case study or two from Aesthetic Care Med Spa, check out the link in the notes below.
Lot of faith.
Which
yeah.
says a lot about you and the relationship that you all had.
Yeah, I think it speaks volumes about that. And thankfully, like, it's been, for us to grow together. Obviously, it's, and we're so close, like our families, like, we've walked this path, and I know that, I tell her, I'm like, she keeps saying everyone is replaceable in this world, but I'm like, I'm telling you, the day that you tell me I'm closing Lumina, because I cannot even imagine any of this without her. And so, but yeah, it's then, we've been lucky again just to find really good people. And sure enough, we've had, to let go some people have had to leave for other reasons. But, today, I can tell you today, the team that we have is absolutely amazing. We are, we're here to work. We're here for the patients. We're here to deliver great care and excellent customer service. Like you're saying, it just goes back to that. It's that, like you're saying, that Nordstrom experience they have, it makes perfect sense for them to come from that background, because at the end of the day, especially, medical can be a little different. Patients need that. But when we're talking about aesthetics, patients want that, right? And they can find that, and they'll look for that Nordstrom experience, that amazing, just even when they walk through the door before they've had any interaction, just that place that feels amazing. And then with the interactions, they just feel like they belong there. And so, it just makes sense that some of the staff may come from that background, because it's the perfect setup for that.
Well, I love your story. I think so, I've had an amazing opportunity to work with so many clinics around the United States. And oftentimes I'll work with physicians that are either ER doctors, or whether it's a vascular doctor or an OBGYN or a family practice, and they've opened up an aesthetic center, and they're still working part-time in the hospital and then trying to get their aesthetic clinic up and going. And, my philosophy has been always like, you just got to jump in, to split your time that way, to me seems so, it's to your, like what you were saying earlier, there's so many surprises that came with opening a practice. How do you think it would have gone if you would have stayed half in the hospital and half trying to open your aesthetic clinic?
Yeah.
What do you think, or what would you say to them?
Oh, I think it would have been, I mean, it's always been a challenge and it never stops being a challenge. I mean, as you grow, I know that you guys have recently expanded, and I mean, all of that, even that growth with a practice that's super established. I mean, everything just demands you like 120% or 200% of you. So I don't see how, if I had done this, half and half, I mean, I guess I could have made it work, but it would have been, a way harder. And I don't think that we would have done it like halfway as good as we've done, right? Because you just have to be here. I mean, I can tell you from, when I opened the practice, I still thought that I could do a little bit of arterial work. And very, very quickly, I, figured out there's no way, like, this clinic is, and this office, and this is not going to work if I'm not 100% here and 100% committed to, the patients and being available and being here to like deal with the situations that arise and all of that. So, I mean, to say that it's impossible, I don't think it's impossible, but I think it's just going to be much harder, take way longer, and the results are just not what they're gonna be. I mean, I think that when anyone who's thinking about an aesthetic practice, like, again, it all ties back to that client experience, that customer service. And if you're gonna do things like halfway done, it's probably better to not do them. Just, that's just my opinion. I think that there's no way we could have gotten where we are if we had like done just half the effort, which is what you can do if you're 50% of you is somewhere else and has other responsibilities and commitment. So
right. Well, I agree. I was just curious because you have gone exactly through that,
Yeah.
I think it's so helpful for our listeners to hear about your experience and how you got the courage to just, to go for it 100%, 120%.
And I'm telling you, I do have to say, I mean, it would be unfair to not, like disclose that I am also in a fortunate position in that my husband, like my household does not depend fully on me, right?
Mm-hmm.
And so, because the story may be different for someone who, their families depend on 100% what they do. So, I think it's only fair to like say that, I'm fortunate in that I had full support of my husband, and my household was not going to like fall apart because I, just suddenly decided to do this. So that definitely, that situation may be a little bit different and just make it a little bit more challenging for someone. But yeah, I mean, I think that if you can, like, the goal should be to just go 100% into the plan and make it work when it's like the right time, right? And that maybe you wait a little bit longer and kind of like get a stronger foundation, and then when you're kind of like just planning so that when the right time arrives, then you go 100% in.
Definitely.
Right? Mm-hmm.
Definitely.
Yeah.
So looking at your practice, what are the top 2 or 3 procedures that you are the most passionate about, or that you do the most?
Yeah. So I, as a vascular surgeon, I absolutely love my veins. So I love sclero, and I love, just treating varicose veins and just helping people kind of get their legs back. And being in Florida, like literally everyone, I mean, it's, and I'm telling you, my mom is still to this day like that. I mean, she's like, she won't go to the beach and wear a swimsuit like comfortably because she has spider veins and all of that. And so, as much as I tell her, this is your life and who cares? Like, nobody's looking, just go and, wear your swimsuit, and it doesn't matter your legs. People do worry about that. We're our own worst critics. And so being able to help women and men that way, that is very, very satisfying. And then from the aesthetic side of things, I mean, I really enjoy I love Halo. I'm like a huge Halo fan. Oh my gosh, I absolutely love Halo. And just, the results that we see, just the changes that we see are just so incredible that Halo has got to be one of my absolute favorite treatments to do. We essentially offer pretty much every single BTL device treatment here in the office, but so it's very satisfying to see the results, but I don't get to do those. Obviously, those are, I hear them going, but I don't do them because I don't have to. But it's also very satisfying to see the results that we are getting with, with things like M-Sculpt and face and, Emsella, it can be life-changing. So those are definitely like very gratifying treatments to offer in our practice.
So being such a specialist in sclerotherapy, how often are you using Sclero versus something like, an Nd:YAG, maybe
Yeah.
Clear V or...
Right. So I definitely I'm very, very, I guess it depends because if it's the legs, I definitely, Sclero is the absolute gold standard, like no questions about that. So we're very, for leg veins, we're definitely, doing definitely like over 90% with sclerotherapy. Now, we do a lot of treatments for vascular lesions elsewhere in the body, and actually for the legs as well, for certain patients that just, for whatever reason, they don't want or cannot have sclero. But as far as the laser goes, we obviously we have Clear V, which is an Nd:YAG, and it works beautiful for face veins. We've had amazing results for under eye veins, or the little broken capillaries on the face or the nose. I mean, it's just, we use them both and we use them all the time. It's just, I think vein legs or leg veins are definitely they resolve much better with sclerotherapy. There's just very subtle differences between the veins in the legs as far as them being under more pressure. It's more deoxygenated blood versus more of the oxygenated blood that we see, for example, in broken capillaries on the face. So, I mean, it's just nice that we have both tools. And it's mostly the location and the type of the vascular abnormality that we're treating. But, we see great results with both. We love both.
Well, I was asking too, I know we've talked in the past about sclerotherapy and just, really the training that it requires to really be good at it. And I think similar to how we were talking about in business, kind of having one foot in and one foot out, it makes it difficult. You just really can't dabble in sclerotherapy either,
Right. For sure. Yeah.
Right. I mean, it's if you're going to do it, get the right training, spend the time to get the right training, spend the money to get the right training, practice a million times, and then launch it and be ready to have either yourself or someone else doing it often so that you don't lose that skill is what is what we feel, because we have a specialist for sclerotherapy in our clinic. And so I'm just curious, if you were to train, because I know you also do training, so I'd love to hear about that. When you do offer training, what are your suggestions? How does that training look so that you can help a provider get up and going with sclerotherapy? Because I know so many clinics want to offer it. They're just not sure how to get started or where to go.
Right. I think that, obviously we start with a, basic foundation and understanding of, what those are things to look for, because I think one of the main reasons why even people who are doing it routinely fail is when they don't identify that there's a deeper issue that needs to be addressed. I mean, even before you start injecting anyone, I think there are basic questions and just a basic physical examination that will give you hints as to whether someone may have a deeper issue that needs to be addressed first. And the easiest way that I put this, to the patients or I explain it is, if you have, if you have a stain on the wall, you can go to Lowe's or Home Depot and buy paint every weekend. You're going to be painting over that your entire life until you get that pipe that's leaking behind the wall fixed. It's literally the same thing. So if you have an issue as far as venous insufficiency, or you have higher venous pressure from, venous insufficiency or venous congestion, you can do a sclerotherapy all day and be great at it. You're never going to get the results, and you're just going to be spending time and money and not get the results that you want. So kind of understanding that foundation is very, very important, because it can be very frustrating. And then as far as the technique itself, I mean, it's actually not very hard, but it's just, kind of sharing those tips and tricks. And like you were saying, Kathy, I mean, it's all about just doing it. And so, it's kind of getting over that hump of being afraid and being scared of this being a, brand new procedure that you're bringing to the office. It's actually very safe. It's very, very hard to hurt someone with sclerotherapy. It's more getting good at it so that your patients are happy with your results, and you don't have unsatisfied patients that are coming back because they're not getting the results, right? So just sharing those tips and tricks. And at the end of the day, it's just, obviously they'll get to do some injections while they're here. And, the most important thing, and I think that applies with like everything when you're learning Botox, when you're learning fillers, when it's trying to get busy and doing it like, frequently, like as soon as you're done with your training, like don't let a lot of time go before you start really like doing it. And whether that means, I'm telling you, you'll find people who have spider veins literally like everywhere. You don't have to find for them. They're everywhere. So just ask. And I know, a lot of people will want to volunteer or, just do it at a lower cost at the beginning. But the main thing is to get as many like Sclero sessions under your belt as quickly as you can, because it's at the end of the day, it's all about getting comfortable. Mm-hmm. So that's kind of what we do. Like you're saying, there's literally very little in terms of training out there in the world. But there's, it's just gotta find like a good place that has the volume, that has the ability to like offer that to you. And then when you're back home, just get at it, because it's all about just repetition and doing it and getting comfortable. And like I said, just getting over that fear. Again, it's very, very hard to hurt someone. Obviously you can, but it's very hard to hurt someone. So, kind of like understanding those things is what we find is very helpful for the people and the clinics that come to train with us.
And so for training, if there are some listeners out there that are interested in that, could they just contact your office manager?
Absolutely. Yeah, absolutely. Yeah, they can contact our office. We can share like my manager's information. She can provide kind of like what we have set up. It's really fun and it's very, very easy. So yeah, we'd love to have, anyone out there who's interested in doing sclerotherapy and doing it the right way. Like we would love to share that.
Well, we will definitely link that in the bio for the podcast, because if you're going to choose, your office is just so successful with it. Your background is amazing. And look at her Instagram page. It's so fun. You're going to have fun when you go to her office. And I think that's a big part of it as well. Yeah. So we'll make sure to include that information when we get the podcast launched. So thank you for that. Thank you for being such an amazing resource.
Oh my gosh, no.
I was looking at, just kind of saying, so you mentioned Sclero and Halo, and you're a BTL, focused clinic. Mm-hmm. So within all the BTL products, what do you find to be the most successful, or, what do you love about it? What makes you excited about BTL?
So what gets me really excited about BTL is the fact that they are very, very safe devices that truly deliver results. I also like, from my background in research, that they're backed by science. Like if you look at pretty much any of the devices out there that we use in aesthetics, like sure, there's some clinical papers here and there, and they have to come up with those papers to come, for the devices to be approved. But I think that it's amazing how the research is ongoing, and there's so much coming from like so many big names, both in the US and around the country, just showing that this, they really, really work. And again, in a completely non-invasive, very comfortable way. All of those treatments are extremely comfortable. And from a business perspective, one of the things that I love is that they don't require me to do them, right? Which is very important. So, while, Halo, I have to do the Halo. Sclero, I do the sclerotherapy, the vein treatments, I have to do them. So the minute that I'm not here, or if I'm giving a talk somewhere, or if I'm on vacation, BTL devices are running, right? So from a business perspective, it's really nice, because I know that, again, going back to the safety standpoint, I think it's really, for me, like I feel confident getting on a plane and leaving Orlando and knowing that the patients are getting treatment and that they're not going to get hurt, right? Like you don't need to be an MD to put someone on EMSCOT, right? Mm-hmm. And so...
Thank you for listening to the Making a Multi-Million-Dollar Med Spa podcast. We are honored to have the opportunity to support your practice. If you like this podcast, we would love it if you left a review. Ratings and reviews allow more practices and industry professionals to find us. If this episode has inspired you, share it with a friend. Together, we can empower our community through continuous learning. We truly value your support of the podcast.
it's just, I think, all of those things, the comfort level, the practicality of the treatments, how safe they are, and the fact that they don't demand my presence to be able to be running I think is those are like the main factors that we really, really like about BTL devices.
So we have the Neo, and we had, we started with BTL with Exelis. I mean, we've gone through their products as well. We've had them, really since probably when Exelis launched.
Actually, it's launched.
Yeah. But we don't have the M face, and I know you do. So I gotta ask, is it working as as you would expect it to work? I mean, what do the maintenance treatments look like? I'd love some details about the face, just for my own personal.
So we love M-Face, and we have some, I mean, obviously there's VNA circulating everywhere from, some of the big names that have done all the research with them, but we have built our own library of VNAs with M-Face, which is absolutely amazing. We do use a Quantificare for our photography, especially for the body contouring, but has been really, really good for M-Face to see the lift. So when we do those VNAs and do the 3D analysis, we can really see the vectors as far as where the structures are being lifted, and we can actually quantify how much. And we
I'm not familiar with that. Sorry, I didn't mean to interrupt you. I'm not familiar with that photography system.
So we actually got it up first mainly for Emsculpt, because it's just one of those that gives you like a 3D recon of the body. So you can only, not only see kind of just from looking at it, you get very, very detailed objective measurements as far as circumference, right? Abdominal circumference, and you can see volumetric changes. So you may have seen there's some, for example, when you look at Elastin, the transform body, how sometimes they'll do a VNA where there's a blue shade over the abdomen, which just shows volumetric change. So that's the kind of stuff that we can see with Quantificare. And so
because we had one for a little while that would spin.
Do you have the Staiku or?
Yep, the Staiku.
Yep. So it's similar to that. The patient just literally stands on this. It's a very small platform. I mean, barely just to fit your 2 feet kind of thing. And there's a camera, which the what makes it different is they patented this thing that goes over a professional, like a Canon camera or a Nikon camera. And it is able to get kind of literally the same picture, same distance and everything with the rotation, and give you very, very precise measurements as far as the circumference or the volumetric change. And I'm more than happy to share that with you. But for M-Face, it allows us to see, again, that volumetric change, because we, in general, we tend to, studies have shown that when you do M-Face, you essentially gain almost like a full syringe of filler, right? And so we would expect a positive volumetric change in the face, aside from the lift. So we are able to see, arrows or vectors that show us the direction in which the structures have changed, how much lift, for example, we're achieving in an area, and then those volumetric changes. Obviously, it allows us to see the change in improvement in wrinkles and things like that. And so, we have a bunch of pictures, VNAs from our own patients that are just beautiful results. So our results have been really, really pretty. And, like I was telling you when we were talking the other day, I've had the pleasure of being able to help BTL launch M-Face in South America. And literally all of the pictures that I show are literally our own. Which is just very gratifying, right? Because sometimes, and this happens all the time. We borrow and we use pictures from other practices or other studies, but M-Face is one of those things that we've been able, and same with Emsculpt, we've been able to use our own VNAs, which is just absolutely beautiful. Absolutely beautiful.
I always joke with Matt. I'm the photos sometimes take me longer than the treatment. And when I know it's so important, but I think that's
so important. I know.
Yes. One of the reasons why clinics sometimes don't share is because they didn't capture it.
Yeah.
because the time it takes to capture and the busier you get, sometimes that starts to fall
It's
away.
crazy. And it's like kind of like the thing that you start, sacrificing when you're, when there's a time crunch and you're rushing and everything, or, the other struggle that we have. And actually just earlier this morning, I was having a conversation with one of my estheticians. She actually just literally took our computer, for the pictures, and she took it home and worked on it last night because we were so behind.
Wow, that's
but
amazing.
you have to, it's just such a key, just even to show, for your own patients. A lot of patients will ask for your own VNAs. Like they find the other stuff online, they want to see yours, or, for us to, again, like I'm doing, I'm talking about M-Face in other places, BTL, same thing. Like you want to be able to show your own experience, but even just for the patient, it's incredible how sometimes, patients will say that they see a change, but if you're able to show them something like an objective measurement, right? Like that just is so powerful that they're like, oh my gosh, I felt this work, but this is like, oh my gosh, like I'm blown away. Or the opposite, they tell you, listen, I didn't see a change, but you show them, then you're like, I have objective, measurements and I have pictures to show you that you've had a result, right? And
Which
so that may protect
powerful.
you because it's very important. Unfortunately, that can happen. There's patients who really don't feel they had a change. There's patients who have other motivations, like they just want their money back, or they want you to give them something else. And this protects you from that as well. So from every standpoint, I think photography, and I know we all know it, but we all really need to make sure we're staying on top of it. It's just so crucial.
Oh, I agree.
So
we use the Vizia system from Canfield, and then we also use RX Photo for like quicker photos in the room with injectables and things. But to have a system that actually gives a measurement, especially for volume, either increase or decrease, right? Between face or body. But I think would be so powerful because we use the BTL Neo, but we also do a lot of pulse sculpting, and we'll do combination therapy between the two devices.
Oh, of course.
Really great.
Oh my gosh, I know. I can tell you even from my own experience, like when we first got Neo a couple of years ago, I did it. I've been thin, right? But I've had two babies, so I have like the little baby fat that it's always super stubborn. So I did Neo when we first got it, and I did my 4 treatments and blah blah. And just looking at the VNAs, I was like, I really don't see a dramatic change, which happens. When you have someone who's like very young or they're very thin, like you're never going to have like a show-stopping VNA, right? Like there has to be like some really bad signs of aging, bad pigmentation to really like have that home run.
Those are always more fun.
Right. But then, I was like, I really don't see it. I definitely felt a difference in terms, for example, of the posture, but not, I didn't just the VNA, just looking at the VNA, I wasn't like crazy, but we did the circumference and the volumetric change, and like it was undeniable that I think it was like an average of 3 or 4 centimeters when you look at the circumference, which is at the end what matters.
Right. And to me, it's always interesting to me because I do the same thing where I'll have a treatment. I'm like, I don't know if I see the result, and then I'm like, oh my God, I'm my client.
That's how it is. I'm telling you, it's like some people are a little bit crazier, but it's just, I do tell patients, it's just human nature. We are like that. Unfortunately, I think the most impressive things, it's like I've had patients who have like snakes, like snakes of varicose veins, like big, like the big bulgy ones. And they've had them for years. And I'm like, how could you forget that you had that big ropey thing going down your leg? But they do. And when they come and we show them like the after, they're like, oh my God, did I used to have that on my leg? And I'm like it just blows my mind. It's insane how you had something that was like massive. And and it's funny, the other thing that's human nature, it's like they won't say, oh my gosh, that big thing is gone. They're gonna start seeing the smaller things, right? Because when you take the elephant out of the room, then you start noticing everything else. So that's what happens to me all the time. So I take this big ropey thing away that totally like was the center of their attention. And as soon as that's gone, they're like, oh, but I have this little thing. They're not like, oh my gosh, I'm super happy that this is gone, but I have this thing left. And this, I'm like, what? Like we just dramatically
You got
change
something
your
for
leg and
it.
you're like focusing on that. Like, but that's how it is. That's just human nature. So I do tell patients, I do talk about that a lot and all the time, because it's just, you don't have to be crazy to think like that. It's just human nature. So
Oh,
yeah.
Are you struggling with high turnover? Do you need expert training for your providers? Are you ready to take your business to new heights? Let Mint Aesthetics provide you with the knowledge to meet your goals, expand your practice, and get amazing results. Mint offers aesthetics training through online e-courses, hands-on training, virtual training, and business consulting. Whether you're a beginner or more advanced, you'll gain a competitive edge by accessing cutting-edge e-courses designed exclusively for professionals like you. Imagine the return on investment as you master advanced treatment techniques, refine your post-care protocols, and expand your knowledge base to offer unparalleled treatments to your clients. It all begins with quality training. Don't wait any longer to invest in your clinic. Join the ranks of successful aesthetic professionals who have transformed their careers with Mint Aesthetics training programs. Visit our website at mintaesthetics.com to book your training or gain access to the online e-course catalog. Your team and business will thank you. Love it. Okay, well, I've brought up your social media a couple times, so I got to touch a little bit on that today. But I think social media, some people are so great at it. Some people they just can't stand it or find a way to love it, and so they don't post as much. I mean, what is your thought on social media and your attack? How do you get it organized? How do you execute it? What is your process with that?
Yeah. It's definitely been interesting because I have obviously zero background in videos or marketing or any of that stuff. And I think I was lucky to discover when Reels kind of started about a couple of years ago, maybe a little bit less than that, but that's something that I enjoyed for whatever reason. I had no idea, but I just kind of jumped on that, especially when they were doing we don't do that as much anymore, but using a trending sound and just adapting it to your own thing and just doing more the lip sync kind of thing
right.
But I really kind of enjoyed that, and that sort of came naturally to me. So I definitely have to say that I enjoyed that. And then I've definitely seen how having a social media and just posting consistently, how that has helped from so many different ways. Probably the two major are literally we get messages, and I have to say my social media, my Instagram account, are completely and 100% done by me. We don't have a social media manager. We don't have someone it's literally 100% what you see. It's literally 100% produced and
Mm-hmm.
made by me, and so but all the messages that we get are just incredible. We've gone for months sometimes without doing any Google ads or paid ads, and we've still kept a steady kind of source of patients reaching out to us saying they saw a sclerotherapy video, oh, I want that, or they see a varicose vein, or they see a BNA on M-Face or M-Sculpt, I want that, and we get them to come to the office. So from that standpoint, I think it's crucial. But the other thing that I actually really enjoy the most is when the patients come to the office. It's they've they know you, they've seen who you are. They already have an idea of your personality and your tone of voice, all of that stuff. So when they come, it's almost like they know you, and that already breaks a barrier that I personally, just because of how I love my patients, I want to just have that relationship with them. It's great because then we can already connect at a different level. And sometimes it's actually funny. I mean, I only have, I think up till now, I don't even have 5,000 followers, but I mean, it's crazy how, everyone already sees you oh my gosh, you're I follow you and I love your stuff. And, so that's just it just feels good, right? It's just very rewarding. And the ability to showcase kind of the back, of kind of that back stage kind of view of things, not everything kind of perfectly organized, but just seeing the staff, seeing, who works here, who the Lumina family is. I think that's just so very powerful.
And so when you're doing one of these social media videos, because, sometimes with my team, they're like, oh, I didn't get my hair done, or, oh, I didn't put my makeup on
Oh
this
my gosh,
morning, or,
no.
oh, and they feel like they've got to like nail it perfectly. And what are your thoughts on that?
Oh no, totally. You have to like completely like get away of that mindset. Like what you want, this stuff is organic. Like it's different when you're gonna make pictures for your website, and it's fine to like once in a while maybe get a professional photographer to do like nice pictures and video of the office for different, and even for social media. Like it's nice to do that once in a while. We're planning to do that soon, but for these kind of things, I mean, just be organic. Just, you don't need to be produced. You don't need to, if you're really like very like self-conscious, there's actually some really nice filters, and I do use them, that are very natural. You just have to play with them, something that doesn't like completely distort who you are. So I do once in a while like use something that, if I literally have like nothing on my face and I'm going to be like super self-conscious, just use like, and I have no problem. Like you can see them as you're going. You can see if I've used a filter or not. I have no problem with that. But yeah, I think that's one of the main things that limits people from like doing it and showing and putting their face on camera. And that should be the least of your worries, because at the end of the day, it's not about how you look, right? We tend to worry so much about that. And at the end of the day, the other people are seeing you for who you are, right?
Right.
Like, I don't know if it happens to you, but it's like if you take a group picture, everyone immediately like zooms on themselves and criticizes themselves, but everyone else is perfectly fine. But the next person is zooming in on themselves and they're seeing you just fine. So I do try to keep that in mind, that we're our own worst critics, and we are the ones looking at our imperfections when nobody else is seeing them. They're seeing you for who you are, and that's what you want. You want on this organic social media, want to show who you are. Like you don't want them to come to the office and then see you and then they had this idea of this person who was overdone and had makeup and all this. If you look at all my reels, I'm like wearing my scrubs. There's actually one reel, and I spoke about this during a BTL conference when I was talking about marketing and social media. Like if I'm wearing a headband, which happens very often, my hair is as dirty as can get. That's just what I wear. It's funny because actually patients compliment me a lot when I'm wearing the headband, and that's actually my worst hair day.
As an aesthetics professional, you know how hard it can be to operate a clinic, onboard team members, improve your treatment techniques, and keep clients happy. The stress of it all can be a lot to handle. Let Mint Aesthetics take some of that off your shoulders. We offer a range of training options designed with your success as a central focus. From e-courses to hands-on training to business consulting, we have the tools you need to prosper in your business. Start with an online e-course before booking a hands-on training. Supplement your learning with virtual immersion courses. However you want to learn, we will be here to support you. Register online or contact us today at mintaesthetics.com. Don't get overwhelmed. Get serious about your success. Get Mint trained.
It's really funny. It's actually really funny. So I don't, I literally like do not think about, any of those things, and just, it's more about finding the moment, right? So like, and it doesn't have to be complicated or overproduced. I think that the main things are, like literally getting someone or as many people as you can in your office to get in the mindset of getting video. It doesn't have to be anything fancy. It doesn't have to be produced, but just when someone's doing, a treatment, whatever treatment, obviously, as long as the patient is comfortable and okay with it, just, get some video on the cell phone. You don't have to have a fancy camera or anything. And then when you realize your phone is just packed with all of these videos where you could have literally like a year's worth of content, you just have to like add if you want to add captions, or you want to do it on your actual caption explaining what you're doing. But that's really it. And especially nowadays that we've moved away from, which I'm actually happy that we've moved away from the reels the way they were. Mm-hmm. And it's more about like just showing the treatments, or showing, like that kind of like how the process happens, or the BNAs. Like it's really what we need to be doing, which is educating, right? So I think people just need to get over and get past that thinking that it has to be complicated. Just my cell phone, I ran out of my 2 teras from from like my, like we pay like for the 2 teras for the storage. And I had to get like, you have to go and get like Apple One for an extra, something called Apple One, which I didn't know existed, that gives you an additional 2 teras, because that's just how much stuff I have on my cell phone. It's crazy.
Wow.
Yeah. And so what I do is, obviously life is busy. And so what I do is, if I'm like waiting or I'm, in bed or whatever, you always have like some downtime, just kind of go through that. And then I have like a little folder where I put videos that I can post. And so whenever I'm in a crunch of like finding something, or today I want to talk about halo, I just go to that folder and find that one, video of me doing a halo on a patient. Maybe it was like 6 months ago. And I just really like add, like some bullet points. You have to keep it, fast and like easy. So, what the benefits are, or what the downtime is going to be, or what the post procedure, like care, like it doesn't have to be anything crazy. And there you have it. You have content. So I think that has made a big difference. It's just having people kind of like taking video and following, and it doesn't have to be anyone who has any experience with like video. It's just literally an iPhone and just take a little video while I do this or while I do that, and then you have it. Great if you can get, like maybe outside of your comfort zone and just sit and talk about something. So the way I think about that is, so I found myself when I was telling patients about venous insufficiency or how we're going to treat it, I was like, I could totally do this for a video for Instagram. This was like a couple of years ago. So then when I started doing video like that, I literally like pictured as if I were, maybe I did have a patient and I asked them if it was okay for us to film, or I got one of my staff, just so that it felt natural, like I was having a conversation, or just even just the cameras, if it was the patient, and just explain it in your own words. You don't have to script anything. And then you have content for days, because you just break it up, or, just make different little, uses of one single video.
Right. And I think too with that, I mean, it's something that, all of our team members, they're having those conversations all day long. And so that probably would feel so much more natural to most of us than trying to find a trending something and doing it off of the trend. Why not just do it off of our trends?
Totally. I'm
going
telling
on
you,
all day, every day at our own clinic.
It's our own, the same thing that you say over and over. I mean, whenever I have students shadowing me, or like I have a new, someone has joined our team and I want them to learn what I tell the patients in the office. It's funny because when I'm just having a one-on-one with a patient and I'm saying my same spiel over and over and over and over, it's like, but when I'm, like when I know that there's someone else like listening, it kind of makes me realize that this is something that you can be sharing, on social media or on YouTube or whatever. And you just literally, you don't have to script any of this. Just put yourself in a situation as if you were talking to one of your patients. So yeah, exactly like you're saying, I mean, your staff, like they have this spiel about like what we're going to need for them the day of the procedure. They need to bring their compression stockings. They need to, this is what's going to happen. They're going to be able to drive themselves, like all of these things. And if you have a staff just sit in front of an iPhone and just do that video and they post it, I mean, it's as original and true and organic as it gets. And they don't have to be like, lip syncing or dancing, like doing any of this weird stuff, which again, I'm grateful that we've moved from, because then again, I think it lends itself to, more of that education, more of that creating that connection, more of like allowing your followers to really see who you are, what your voice sounds like all of those things, which is, so important. So yeah.
Well, I listened to a TED Talk recently and it was on social media. And to be really honest, I love doing videos for education. We have a whole online platform,
of course.
100%. I mean, in the beginning, I was really nervous and worked through all that. But I will say in social media, I don't stop and do that a lot on my own. We have a marketing team. And so often they're kind of driving that. And so certain things for me, I definitely need to improve. But this TED Talk was talking about how, if no matter what is out there or what is not out there, it still is your brand. So if you haven't updated your LinkedIn page or you're not posting about it, the not doing it is also your brand.
Yes.
And I thought, okay.
I know it doesn't matter how, again, and it takes time for sure. But like I said, I mean, thankfully for me, it's not painful. And I think I've developed a system, and I have my 3 or 4 apps that I just use, and it's all on the phone. So like, if I'm like out, my girls are like in soccer practice and I'm just sitting there, I'm like going at it. Or if I'm like traveling and I'm at a gate waiting, I'm doing that. It's funny because my husband has seen all, every single series on like all the streaming services, and I'm the one who's like super behind. Like I only watch it when I'm going to watch with him the 1 or 2 series.
Right.
Because literally like his downtime, he's like, watching. My downtime is I'm literally on the phone, like,
Answering,
looking at videos,
coaching.
posting and stuff. And just, if you look at my drafts, my folder, like I have like at least 20 things that I could like that there. I probably need to do some tweaking. I need to do some captions and stuff, but they're good to go. So I'm always like in that mindset. And I enjoy it. Again, I mean, if this is something that's like super painful and you don't enjoy, well, listen, you're not going to be doing this on your downtime, right? You're probably going to be doing something else. And in that case, it's probably a good idea to maybe hire someone to do it. But like, as we are getting busier, like, everyone's like, you should get someone. But my main concern is I feel that it would probably lose a little bit of the personality and a little bit of the kind of like the originality and the spontaneity of things. And so like right now, as long as I can like handle it, I'll do it because I enjoy it. I enjoy doing some of that on my downtime. Like last night, my girls were watching, some movie, they're kind of like down, kind of like everyone's kind of like slowing down, and I'm just sitting with them and they're watching their thing. I'm like doing my videos and they know that. So they're like, oh my God, I want to watch that video or this video. So like going back to the one that you said, the Mario video, like they totally love those videos. So they go back.
Oh, I bet.
And they want to be like part of the videos too, which I need to actually get better at because for those of you who don't know, you probably know this. I mean, if you have your kids, if they're part of like your videos, you can actually pay them. And that's actually a tax saving strategy. Because you pay them and then you put that money into an account, a student account, whatever. I mean it's gonna benefit everyone. It's not about like using your kids and like putting them on every video or anything, but like
in the appropriate way.
In the appropriate way. It can, it's they I'm telling you, my daughters, like they absolutely love it. Like any chance that they have to come to the office and like be a part of like a video here and there, they're super happy. So they're also part of the family. So
definitely. And so we would mention there's like 3 or 4 apps that you like to use. What are those apps?
So for me, and I know there's a bunch that actually work, but I love Canva for sure. Like Canva is just amazing. It's such a powerful tool. It is absolutely incredible. I do for videos, I like CapCut. So for like, for like speeding it up so that the video is a lot shorter, or like really like cutting little gaps, or like if I'm doing some fancy like overlay and the Canva, I do have like the premium, like the paid version, because I do like having all of the tools. But CapCut, I just use the free one and it's been more than enough. And then there's another one which is called Beadlip, which helps. It's mostly the one that I use when I'm doing like I like to do if I'm going on like on a trip and I want to get like lots of little videos together to do a compilation. That's what I use. It's really, really nice because it gives it kind of like the beats and the jumps and the kind of like the animation to make it, more, not as kind of like flat and boring.
Sure.
But those are kind of like my go-tos for sure.
Well, thank you for sharing those.
Oh my gosh, not at all.
I was introduced to Canva. It's probably been less than a year. And I've just been shocked how easy it is to use. All the things that you can do in Canva. I mean, it's an incredible app. And I think sometimes, as owners, we're so into the treatment room and things like that a lot of the social media apps.
Yeah.
Were a little
I got to tell you, I mean, Canva, I'm not even using PowerPoint. I actually do my PowerPoints on my presentations on Canva. I mean, it's unbelievable.
Well, I need to look at that. I haven't switched to that for my presentation.
Yeah.
I can see how they would be. You would have so many more. I mean, so many more and the options. to
Yeah.
make them beautiful and grabbing graphics and
Exactly. Oh my gosh,
all
so
of
many
those
options. And
things.
so then what I do, if I really want them, because I want to make sure that they're going to be able to be displayed, right? Like if I'm going to have to share a presentation like ahead of time, and I do want to send it in a PPT format.
Mhm.
If you have just pictures, you can literally download it as a PPT, as a PowerPoint. But if you have video, which I actually include a lot of video on my presentation, what I do is, and that just takes a little bit of extra work, but you download each one of those slides that is a video, and then
Mhm.
you just import pictures and video into PowerPoint. You're just expanding them to fill up your screen.
Right.
That's it. And you save it as a PowerPoint, and it's absolutely like it's seamless. I've never had an issue, and the presentations are always just so cool.
I've got to look at that.
Yeah.
That's such a great idea. So
Yeah.
thank you for
It's
that.
really neat. Really, really neat. For me, it has been a game changer.
Well, thank you so much for all
Oh
of
my
your
gosh.
information today. You're just amazing. And before we
Oh,
finish, is there anything else you want to share? Any words of wisdom
oh my gosh.
or
I
anything that
don't
you're looking into now that you're excited about? Or
Yeah, I mean, I would just the only thing I would say, I mean, it's for those of you like out there that are thinking about it. I mean, just do it, like you were saying, right? Like it definitely has been the best decision ever as far as just satisfaction, just having being a business owner, having control, being able to offer amazing treatments and deliver amazing results to patients. And just if you're doing it right, and if you're creating, I mean, the mindset of creating that right client experience, and it is so gratifying and so satisfying that I don't know what my life would be had I not done that. And then just gotta you gotta put your heart into it, and just give it your everything and make it your own. One of the things that I've actually enjoyed is kind of like the community that and the friendships that I've made, like for example, attending the different aesthetic meetings, like when I finally got to meet you in person during that Sciton meeting.
yes. So it's just
And then going back to the social media, I mean, it's just, I think there's so many, practices that offer, let's say, Sciton devices or Sciton treatments and BTL treatments, and just helping each other. Like I've created this community of owners that I know just relatively close to me that have Sciton and have BTL, and we don't see each other as competition. We actually are very supportive. And so we've sat down to talk about this, and marketing has been like my Achilles tendon, has been the pain of my existence. What are you doing? So because for example, I remember in a situation I was actually considering of doing ads on like a streaming service, and then someone was like, oh my gosh, I did that, and I know they promised the world, and that didn't work for us at all. This is what's working for us. And so we literally, like, it's not about competition, it's about creating that community. There's enough for everyone. So even though it seems
absolutely.
like the market is like saturated, and I mean, maybe for some things, like good people and places that offer those treatments that are really like, shows that deliver show-stopping results are far and few. And if you, just together kind of like help each other, learn from each other, that to me has been probably one of the best, and most rewarding parts of, having this business and diving into aesthetics. So, I would, because people are worried about the market being saturated, but there's only a few people doing it right and doing it for the right reasons and with the right treatment. So
I could not agree more. I mean, I'm
yeah.
still shocked. We do a lot of what we call girls' night out, and we have groups of women come in, multiple times a month. And I just hosted one a couple of nights ago, and I asked you, how many of you have been to aesthetic care before? And there were only 2 out of, the 30 that had been here before. And a couple more had heard of us, but that was it. And I'm
That
thinking,
is insane.
we've
I
been
mean,
here
that
for
coming
20
from
years,
you, that's crazy.
So
because
there are so many people that have not heard about us just in our little area.
yeah.
And I think, just doing, like you've been talking about, doing the right thing, offering amazing customer service, taking care of your clients, not worrying about competition, and just kind of building up our industry so that there is trust in it. And it just goes to help everyone. So
Yeah, because there's definitely all sorts of devices and treatments out there that are like, and it's just very frustrating when someone comes in and says, oh, I've had a laser. I'm like, but having a laser is like literally, I tell them, I mean, it's like someone telling me that they drive a car. Do they drive an old Ford or do they drive a Bentley? Like, I mean, it's so crazy. There's so much. So, it's about, kind of like that passion in educating patients about that kind of thing, creating the right expectations. I mean, not just, understanding that with aesthetics, it's all a process and it's a lifelong relationship and it's not a one and done. And explaining, just all of that. I think that it's actually rewarding for both parts because they feel they can trust you. They're not being promised the world, and because that's not how it works, right? And for you, being able to at the end of the day go home and be able to sleep at night knowing that you're doing the right thing, that just it's invaluable. There's no price to that.
Absolutely. Well, thank you from the bottom of my heart for sitting here with me today and sharing so many amazing things and about growth and how to get into this and do it the right way, and all the details between your training with Sclero and social media and all of the treatments that you provide. Seriously, thank you so much. I feel like sometimes we don't share enough of our secrets, but to your point, the more we share, the more we all grow, and
exactly.
it builds us up as an industry. So
right.
Thank you again for being on, and thank you, Mint listeners, for checking out this episode of the Making of a Multi-Million-Dollar Med Spa podcast.
Thank you for having me. Bye.
Thanks for listening to today's episode. We would love it if you left a review to help other providers and clinics find us. Also, if you want more information about anything we discussed in this episode, check out our show notes. Until next time, this has been the Making a Multi-Million-Dollar Med Spa podcast.